when I was just starting medicine, I always imagined that I would examine somebody and find exactly what was wrong, and I was hanging out to learn how to examine people. But we had a lecturer, and this was in the early years, who said to us, look, examination is of minor importance. In fact, the most important thing is the history. You will learn everything you need to from the history. And at the time, I thought, well, yeah, he obviously is confused, but he wasn't. In fact, this is the truth. The history is the most important interaction between any health professional, healer, doctor, whatever sort of person you are who helps others. Taking a good history is utterly and completely vital. One of the main reasons is that everybody has a story, and they want and need to be heard. So one of the first things to do is to sit down, to free your mind of preconceived ideas, of jumping to conclusions, of, as the person talks, thinking, oh, it could be this, it could be that. Let it all go. Let it all go. Sit down, create an infinite space for the story that the person has to tell you to come in. And this is what I do. I sit down, I fall still, and I just listen. And as I listen, unbidden things come up from my subconscious, things that I couldn't even have imagined from before. If I'm absolutely still and just in that process of listening, the right questions pop into my head. Now, this is something that's occurred over many years. However, there is a little bit more process that you need to go through to make sure that you don't miss important facts. The first thing I need to know is what the problem is. And some people are amazingly vague or disconnected from their bodies. So there is this vast range where people will describe, some people on the one end of the continuum will describe in exquisite and incredible detail exactly what has happened to them, how the color of it, and all the intricacies of it. Now, when I hear that, it actually gives me a sinking feeling, because I know that what they have done is they've focused in too much on their symptoms. On the other end of the extreme are people who have absolutely no way of describing what's actually happening to them. They'll just say, it hurts. And I'll say, tell me more. Because they see the two types of questions. There's what's called an open-ended question, and there's a closed-ended question. So the open-ended question is, if the person says, oh, I hurt, then you say, tell me more, and it leaves them open to say whatever is important to them. I could use a closed-ended question where I'd say, is it burning? And they'll say yes or no. So I've closed everything right down. And if I do that too soon, then what happens is that I'm running it. And if I'm running it, then I will only get what I want, which isn't really what the person needs. So what you need to do in the beginning is ask these very, very open-ended questions, but to understand what the symptoms are. So the first thing is it painful? And I'm a pain specialist, so everybody comes to me and they describe that they have pain. I need to know exactly where it arises. and they can't be vague. They need to actually show me where it is. Where is the pain? I need to know where they feel it arises. Then they say, oh, it hurts all over. I say, that's okay. Just an instinctive thing. Put your hand where you feel that it arises from. What's the center of this pain? And just about everybody will put a hand somewhere and say, this is where it comes from, and then it spreads all over the place, or it does what it does. So everyone has a sense of where that center of the pain is. It's the first thing. Where is it? Where does it spread to? What type of pain is it? Because the type of pain gives you an idea of what structure is causing the pain. This is very broad, but if it's a deep ache, it is very likely to be one of the structures. It'll come from a joint, it'll come from a muscle, a tendon, so a deep structure. If it's a shooting, stabbing, electric-y pain, there is a nerve being irritated, so that's a different kind of pain. You get, if it's sharp, it may be more likely to be nerve related, because again, what people, the type of pain that people, or the words that people use to describe pain are not precise. So I dig, and I spend time until I have a very good feeling of where the pain is, where it goes to, and the type of pain. Then I wish to deconstruct I want to know the history. I want to know the history very exactly. What were you doing when this pain came on? And I don't want vagueness. Sometimes people say, well, I don't know, it just sort of came on out of the blue. And I'll spend time. When did you not have the pain? What were you doing? How? Do you actually believe that there's anything that you have done, or anything that you had done to you, or anything that you ate, or anything? What do you think is important in setting off the pain? The next thing is that I then I track what has happened. So I want to know when it first started, what treatments they had, what happened. So you had a motor vehicle accident, where did you go? What then happened? You ended up in hospital. What did they do? You went home. What happened? I need to know, to get really a round picture of what is actually causing the progression of the pain until finally it has reached, you have come to see me. So a lot of people have, I'm kind of the end of the road doctor, so there's often a long story about who they've seen, what they've tried. So what treatments they've had, what medications they've had, what investigations they've had, and so I'm getting a round picture. How does it make them feel? That's really important. What does the pain do to you inside? How does it change your emotions? Do you actually feel depressed? Do you feel hopeless? Do you feel anxious? Because the thing about pain, and this is in its definition, is that there's a sensation, but there's also an emotion. It's an unpleasant sensation which evokes a negative emotion inside you. So for it to be pain, it has to really get you. And people who say to me, oh no, it doesn't really bother me, either they don't have a significant pain, which is very unlikely because they're coming to see me as a pain specialist, usually having seen a lot of people, or they're not really in touch with their emotions. And then it's important for me to explore that a little bit. So we've discovered what caused the pain, we discovered where the pain is, and what type of pain it is. We've discovered what caused it and the whole evolution of the pain, what kinds of treatments they've had, what effect the pain has on their emotions, and what has happened in their life because of the pain. So there's a word called disability. What are you able to do? What are you unable to do? What things that you're really passionate about have you had to stop? You know, I can't go out and garden anymore. How important is that? That's incredibly important. I used to use that to just get a bit of sanity in my life. So these sorts of things. Can you do what are called the activities of daily living? Can you dress yourself? Can you wash yourself? You know, can you do the cooking and so on? These are all incredibly important facets of what's going on to understand what this pain has done for that person. And you can't get that in 5 or 10 minutes. You just cannot. If you think you've got it all in 5 or 10 minutes, you haven't. You need to create space. You need to create this feeling of, yes, tell me more. And that sounds awful. That must have really been concerning to you. How did it make you feel? What effect did it have on you? What effect does it have on your family? Broader now. What effect does it have on your friends, your relations, on your job? Are you still able to work? And so on. So you're now widening out what effect this problem has on this person's whole life. That, for me, takes at least 40 to 60 minutes. And at the end of it, I have a feeling about where that person is, what that pain is doing, what effects it has on that person, and then I will move forward to examine. And the examination is important, but the process of getting the history is more important. I also need to know what other medical problems the person has, because that can have a huge impact. What other medications they take? Do they have blood pressure? Do they have diabetes? And, you know, there's or any kind. Do they have mental illness? Do they have a history of schizophrenia? Is there? So I take a while to explore, because sometimes people have a very complex past medical history which has, well, may not have that much to do with the pain, but often has a bearing on the pain, and sometimes turns out to be actually one of the vital things that you need to address to help that person in pain. And also the other medications, because there are often interactions between medications, and sometimes different doctors see only little facets. I'm the eye doctor, or I'm the heart doctor, or I'm the gut doctor, and people miss the bigger picture. And I really like to know the bigger picture, because the bigger picture is utterly vital. Okay, as a massage therapist, I think that there is a lot of what I've spoken about that you can and should ask about. A lot of it is really, really important for you to get a feeling of where that person's at. And sometimes you are the first person that has sat down and taken that time. And what you do when you have this kind of rapport is that you start to build up a relationship, and getting better has everything to do with a relationship between you and the person who is helping you. So your role isn't confined to just laying on of hands and doing things to the person's body, but you're interacting with them as person to person, and that kind of interaction often will augment healing. There are other things that medical science doesn't really look at in terms of healing, which I believe are incredibly powerful. And these are what we've talked about, which is a communication of person to person, and also some people have a healing gift. If you're one of these lucky people, then doing this will help you focus your healing gift. I think being listened to is one of the most important parts of starting to get better. That a lot of illness arises within our being at quite a deep level, at a perhaps a subconscious. There are processes going on in our mind which come out in our body. So feeling that there's somebody who listens, who takes the time, who cares enough to hear your story is a first and incredibly important part for the person to start feeling that they're going to get better. It's that important.